Hi, good afternoon, and thank you everyone for attending our Marches for Thursdays Lunch and Learn webinar. We are very excited to announce our webinars are now sponsored in part by HEB, and we are extremely grateful for this new partnership and really looking forward to our future with them. Everyone, please remember to hold your questions until the end of the presentation. Questions will be accepted via chat and by phone. I will soon mute the phone. And for anyone that's on the phone, could you please mute your phone as well so that we don't have an echo?
All callers are muted and they can unmute themselves.
I would now like to introduce our presenters, Kelly P. Hodges, National Program Director, and Latanya Neely, Patient Navigator, both with Sisters Network Incorporated. They will be presenting Navigating Through Survivorship. Ladies?
Oh, okay. Thank you. Hello. How's everyone? I am Kelly Hodges, and
I'm Latanya Neely.
without further ado, we'll go ahead and get started, Ashley.
Yes,
Okay.
ma'am.
All right. Well, as most of you know, Sisters Network is the only national African American breast cancer survivorship organization. And this year, 2014, we're actually celebrating our 20-year anniversary. Sisters Network was founded in 1994 by Karen E. Jackson, who at that time was a one-year breast cancer survivor. So now, 20 years later, we are here thriving and doing quite well in Houston, surrounding areas, and actually across the country. Myself and Latanya Neely will be presenting today. I will cover information as it relates to Sisters Network, who we are, and what we do. And Latanya Neely, our patient navigator, will talk to you a little bit about our project, Navigating Through Survivorship. Did I pronounce it right? Okay, Navigating Through Survivorship. So I will turn it over to her part of the way through. And this slide here, it just gives you an idea of who our membership is. This is from our 13th annual conference, which had a focus on leadership. Sisters Network has over 40 affiliate chapters across the country. We're in various, I think 23 cities now across the United States. Some of our cities, we do have multiple chapters, and they're just thriving, and we're doing phenomenal things across the country. And this is a map that actually shows where we are across the United States. We have our newest area is actually up in the Washington State area, and we're really excited about being in the Washington State area. But as you can see, we're heavily concentrated on the eastern part of the United States. Not that there aren't disparities that exist in other areas or areas where we don't have the pink ribbon, but Sisters Network is survivor run. So we only start chapters in areas where the community has contacted us and said that there's a need for Sisters Network. So we don't go out and try to recruit people to start chapters in specific areas. We only do it if we receive a call. And our affiliate relations manager actually coordinates those efforts. She works with persons that are interested in starting a Sisters Network chapter in their respective communities, and then we kind of work from there. And this is our board of directors. Karen Jackson is our founder and CEO. She's our board chair, and our vice chair is Betty Eubanks. Betty also designed or painted our national mural, which most people have seen it, and I'm not sure if I have a picture of it in this presentation, but if you ever go to our website, it's actually on our website. We have a national picture, and she also painted the picture that was used here locally for the a project done at MD Anderson by Dr. Leslie Shover. So she's been with the board since its inception. Camille Cash, she's a local doctor as well. She's a plastic surgeon. We have Judy Boston, who works with our PR, and John Green, who's here locally, and he's our attorney, and Betty Ford. And then we have our medical advisory committee, which is made up of several local doctors and some national doctors as well. As you can see locally, we have Dr. Osborne, Dr. Lavinia Middleton, and Dr. Angel Rodriguez, and Dr. Tamara Como, and Dr. Tanya Stevens from MD Anderson. And then, of course, internationally known is Dr. Lisa Newman and Dr. Harold Friedman. and they've been with Sisters Network from the beginning. And as you can see, this is actually our national staff, and people are always amazed by the fact that we only have 6 staff persons, and we do a phenomenal job with the 6 of us, and we work very hard throughout the country to work with our chapters, to do fund development, and just to make Sisters Network what it is. It's definitely a well-oiled machine, and with the 6 of us, we work very hard to keep it moving. And why do we exist? This is a question that we get quite often because we're always compared to some of the mainstream breast cancer organizations. We quite often have to defend why Sisters Network exists. As a national organization, people want to know why do you separate yourselves? Why are you around as an African American organization? Do you not help whites? Do you not help Hispanics? Do you not help Asians? Well, in 1994, when Ms. Jackson was diagnosed with breast cancer, she could not find the type of social support that she needed as an African American woman. Her needs were different. She wanted to be involved with social support with other breast cancer survivors that she could identify with. So that's why Sisters Network started. And Sisters Network also, as breast cancer began to grow, and more people were talking about it, the incidence was great in African American women. So we as an organization began to develop not only the social support aspect of it, but also program development, because we're a niche population. You have to go to where we are to get the message across. And a lot of the mainstream media was not working. So Sisters Network was established as a grassroots survivorship organization. And I'll talk more about that when I get into our national programs. And I'm sure most of you know the facts that breast cancer is the most common cancer among African American women and the second leading cause of cancer death among this ethnic group, surpassed only by lung cancer. So these are some of the reasons why Sisters Network exists, because we know and research and the data shows us that there is a great disparity. Some of our national programs, our major program is our Breast Cancer Assistance Program, which provides financial support to women who are going through breast cancer treatment, and also once their once they've completed their treatment, we also provide financial support if those bills were encountered once you were in treatment, because as you know, you may not get a bill for 6 months after treatment. And this program was started in 2006 to assist women while they were going through treatment and afterwards, so that they could really focus on, we wanted the survivor to really be able to focus on getting better. The Breast Cancer Assistance Program provides services to women facing financial challenges, and also provides financial assistance, but not limited to medical-related lodging, copay, office visits, and prostheses. And we also provide, the prevention aspect of this is we provide free mammograms to women who qualify, and this is a national program. We have partnerships with clinics across our screening facilities across the country. Also, when I get to that slide, you'll see some of our local partners that we have here in Houston that provide screenings to women, and we actually pay and set up a memorandum of understanding with these organizations so that they'll know our women are coming in to get a screening. We've sent you a payment authorization form. We know that we're going to pay. We just want these women to get screened. And that process has worked really well since since this year, 2014. We've spent approximately $11,000 on our breast cancer assistance program. Actually, it should be closer to about $20,000 now. And we've provided probably about 25 to 30 mammograms to women locally. And I think in the last few months, we've only had one diagnosis of breast cancer, which is really good. And that's with all of the women that have been screened through our program that we pay for across the country. So we do know that our program does work, and it helps those that don't have the resources to get a mammogram for whatever reason. Some of our national programs include and national partnerships. In this past October, we had a campaign with Iman, which is a cosmetics company for women of color, and they promoted Sisters Network throughout the month of October via their website and social media. And they also made a sizable donation to Sisters Network in support of our Young Sisters initiative, which provides outreach and education to survivors that are diagnosed under the age of 45. And we also have a website called the Young Sisters, youngsisters.org. And another program that we have, which targets younger African American women, is our Webinar Wednesdays. You can see the flyer some of the topics that we have. New You, Loving Me, Loving You, which talks about intimacy, breast cancer, sexuality, and dating. And then also fertility, because that's a subject that younger African American women, or all younger breast cancer survivors in general, want to know more about their options of having children after they've been diagnosed. Also, this is on the left, you'll see the slide from the picture of the Young Sisters Initiative, A Guide to a Better You. This is a project that was developed in partnership with the Centers for Disease Control and ICF Macro. This is actually an online survivorship guide. In some of the preliminary focus groups, younger African American women who were diagnosed with breast cancer said that they wanted to be able to have resources that were accessible to them and it was readily available to them. So that's how the Young Sisters Initiative website came about, because that was one of the most feasible ways that we knew to have information readily available that younger breast cancer survivors, because that's what they wanted, to be able to have the information accessible. So this particular website was designed just for that, and the survivorship guide can actually be downloaded from this site as well, and it's been doing very well. We received a lot of positive feedback from it. We've actually written some articles with the Centers for Disease Control as it relates to this particular website and the actual research behind it. And some of that will be updated, the study and findings will be updated and placed on the website in the coming weeks. So we're really excited about this project. And also you'll learn more later when LaTanya takes over about Live, Love, Laugh, which is our survivor socials. And again, this is a program that was designed targeting younger African American breast cancer survivors as well. I wanted to have some of the feedback that we got during the focus groups was that your mainstream support group itself, that word in particular, young survivors just didn't want to have any dealings with it, because it just didn't have the right connotation to them. It was more like they felt that it was a kumbaya kind of thing, and they wanted to go to a place where they could be surrounded by other survivors, and not just be sad. They wanted to hear, good survivor stories and ways that they could cope and have a great, life after being diagnosed with breast cancer. So we kind of came up with this using a younger, fresh face. We have lots of great topics, and LaTanya will talk more about some of the topics that have been discussed in the socials in the last few weeks. And this is just a flyer from the one that we had in March. And this is a snapshot of our national website. Please go to our website at sistersnetworkinc.org. Lots of great information. As I said, we are celebrating our 20th anniversary this year, so we'll have a lot of exciting projects going on. And some of our national events, in 2013, that was the first year that we hosted our luncheon, our Pink Angel Celebration Luncheon and Style Show. And this is our founder and CEO, Karen Jackson, on the left, along with Christine Verini, who is the VP at AZI Pharmaceutical, which is one of our largest corporate sponsors. And that event was well attended and just well received by the community. Something a little different for us as a national organization. Coming up very soon, on Saturday, April the 5th, Sisters Network will host Stop the Silence 5th National African American Breast Cancer 5K Walk Run at Discovery Green Park. Last year we had about 8,000 people in attendance. We're shooting for 10,000 this year. And at the pace that we're going, it looks like we will definitely reach that number. We're really excited about that. So if anyone on the call would like to attend, on-site registration will be open at 8 a.m. on Saturday, April the 5th, and we hope to see you there. Also, in celebration of our 20th anniversary, we'll have our national conference, October the 9th through October the 12th at the Royal Sonesta Hotel, Houston. We're in the process of developing our program agenda. We have our topics. We're just trying to find the right presenters for those particular topics that we're targeting. So look for the agenda probably to come out in May, along with registration will actually open in May as well. So we're very excited about being able to celebrate 20 years. And some more of our national events. About 2 weeks ago, we launched Teens for Pink, which is a national program that we're actually piloting right now in Memphis and Houston. We're hoping to push it national. And the project has received great, it's just been extremely successful. We've reached our numbers. This particular project is targeting teens. We are educating them to become breast health ambassadors and to get that dialogue about breast cancer started in their family. So this, if you get an opportunity, please go to the teensforpink.org, our website, look at the information. The site is great. Teens are really excited about going and just taking charge of their health as well as being the lead in their families as well. Also, our Gift for Life Block Walk, this is the project I wanted to talk about as it relates to how we're kind of set apart from some of the other organizations. As a national organization, the Gift for Life Block Walk was our very first initiative, and it's actually a grassroots effort where we actually, as an organization, go into the community, go door to door, and distribute information in communities all across the country throughout our 40 affiliate chapters about breast cancer, education, also providing a resource list of screening facilities in that respective area, and also other health resources as well. Just taking the information directly to the community's door. And this project has been in existence. I believe it started in 1996, 2 years after Sisters Network was started. And it was launched here in Houston's 5th Ward. And now, of course, it's implemented across the country throughout our 40 affiliate chapters. And then we have the Pink Ribbon Awareness Project, where we actually go in, our chapters go into churches each month, one church per month, and distribute breast health information, talk to the congregation. It's a whole plan that we have, and there are different ways that they can do it. Now with the evolution of the church and how the media is involved and how they're more mainstream now, there are a lot of different ways that we're able to get information across, either via the website or newsletters or e-blasts. So the chapters are charged with providing or being a community resource and being able to distribute that information in the churches. And then also in October, the fourth Sunday of October is our National Day of Worship, where Sisters Network as a national organization worships together across the country. We all host a National Day of Worship in a church in our respective cities. Some of our chapters are very excited about this project, and in the last couple of years, they've done 2 or 3 churches at one time in their respective city. So it's gone over very well. Here in Houston, in 2013, we were actually at Crossroads Church in Pearland. In 2012, we were at Windsor Village United Methodist Church, and in 2011, we were at the Bend, the Fort Bend Church, Pastor Byron Stevens. So it's been well received across the country and has actually received some national media from this effort. So I will now turn it over to my partner, Latanya Neely. She'll talk to you about our navigation project. You're going to switch. Give us just a second.
Good afternoon, everyone. I am Latanya Neely. I'm the patient navigator with Sisters Network, Inc., and I just want to talk a little bit about our Navigating Through Survivorship program. This is a program, we received a grant from Coleman Houston in 2013, and the primary goal of this program was for us to retain and support at least 66 African American women in breast cancer survivorship care. However, we have surpassed that goal, and we have navigated 127 women as of March 2014, and we have held 6 survivor socials. So we're really excited about that. I want to talk a little bit about our program goals and objectives for this Navigating Through Survivorship program. We have 3 primary goals, or 3 objectives. Our primary goal is to retain and support 66 African American women in breast cancer survivorship care. And there are 3 main objectives that we focus on. The first one is increasing the number of African American breast cancer survivors who receive patient navigation services. Now, what does that mean? That means that when we have someone call in who needs to be navigated, we talk to them and see what their needs are. What type of navigation does this particular patient or client need? Those services can range anywhere from transportation to and from their doctor's appointments or treatment appointments. Services can include accompaniment to a doctor's appointment. If the patient does not have a support system in place, then myself or someone in our office will accompany the patient to their doctor's appointment so they have someone there with them to support them through the process. We also provide financial assistance for co-pays, prescriptions, utilities, and prosthesis, whether it be breast or cranial prosthesis. We also provide mammograms for women who are uninsured or underinsured. Okay, our second objective is to increase the number of African American breast cancer survivors who receive social support. We do that through social media as well as our monthly survivor socials that Kelly mentioned a little bit earlier. As far as social media, we currently use Twitter, Facebook, Instagram, and YouTube to increase our social support. We actually have a social media coordinator on staff who coordinates all of that, and she is able to post information, not only what's going on locally here in Houston, but she posts information about information from our affiliate chapters in other cities. So all of that information can be found on Twitter, Facebook, Instagram, and YouTube. In 2010, Sisters Network partnered with the Center for Disease Control to launch the Young Sisters Initiative. And again, as Kelly mentioned, this program was designed to reach women under the age of 45 via social networking. So there is a separate social networking site for the Young Sisters Initiative, which can be found through our website. Our survivor socials. Our survivor socials are meant for the survivors and their caregivers and or their support person to come and receive the information that they need and receive the support that they need in a social environment. They're invited to attend monthly social support group meetings at the Sister House, which is our national headquarters of Sisters Network Inc., which is located in 3rd Ward in Houston. We cover many different topics that are relevant to and have been requested by the attendees of the social. Some examples include living the new normal, because we know that we have lived a normal life one way before diagnosis. However, after diagnosis, our normal has changed. So we now have a new normal. We've also talked about nutrition and fitness. We've had a session on what does my diagnosis mean and how do I talk about that to my family members? How do I explain what stage 1 or stage 2 is to my loved ones? Also, when we have individuals come or attendees come to the socials, the people that we have speaking to them are experts in that particular area. So we do have oncologists who speak. We have therapists who speak to the group. We have certified fitness instructors and nutritionists who present the information so the attendees can feel comfortable in knowing that they're receiving valid information from credible sources, which is very important going through this treatment. And this is also very special to me because I'm a young survivor myself. I was diagnosed with breast cancer in 2011, so I'm about a 2.5-year survivor. So I'm very, very close to this program, and I truly understand what it means to have this social support or these survivor socials. And our third objective is to increase the knowledge of cancer survivorship and survivorship resources. We do this through our webinar Wednesdays, our survivor socials, of course, and printed material. We also have a survivorship guide for African American women that was developed along with the University of Maryland. Our webinar Wednesdays are held once a month, and they're supported by Breast Health Collaborative and Cancer Treatment Centers of America. When we're talking printed materials, we have pamphlets such as breast health awareness pamphlets and key questions to ask your physician after a diagnosis. Because we know that there are some things that there's so much going on in our heads after we're diagnosed. I was the same way. There were so many things going on in my head. What do I ask? What do I do? What is my next step? So the key questions were developed to help me and other survivors know what are some things that we should ask. What are some pertinent questions that we should ask? And then once we filter through all of that, we can figure out what else we need to ask. And here are some very pertinent and important questions that we should ask. This printed material is also able to be used in other organizations. If they request brochures, we can send these things out to them. Anytime I encounter a survivor or a newly diagnosed survivor, I absolutely make sure that I give them the key questions for them to have with them to look over. And lastly, I mentioned a survivorship guide for African American women. This is a video that focuses on survivorship care, including ways to optimize the quality of their follow-up care and reduce the risk of reoccurrence. As with anything, we have encountered a few challenges through this program. However, there were not any that we could not handle. One of the challenges that I found was as I was navigating patients, the results, well, if we were sending them out for mammograms, we were not receiving the results back in office of what happened after they had their mammogram. And so we want to be able to, or I want to be able to close out, so to speak, those services. So we need to be able to have an endpoint, some type of endpoint, and having those results would let me know if you needed to be further navigated because maybe you were diagnosed or if everything was well with you. And so we can close that out. So that was one of our challenges. And we do have some clients that will sign a release of information form. However, it's the ones who do not sign the release of information form that we have the challenge with getting the information from. So what I've started to do is request verbal results from those clients. I keep a call log, so I know when the appointments are. I call and remind the clients about their appointment. After they've had their appointment, I check on them to see how it went, how were the services, how did the staff treat you, and then a couple of weeks later, I follow up with them if I haven't heard from them and say, hey, have you gotten your results back? What did your results find? What did you find in your results? Everything was great, wonderful. Then I can document that on my survivorship spreadsheet saying that their results were clear, everything was fine. And then I just also offer our services. If there's anything else that we can do for you, then please feel free to contact us again. Another challenge, this is for the survivor socials. So increasing our physical attendance so that it represents the number of registrants for the survivor social was a challenge. So what that means, for example, is we may have 45 people registered for the event, but only 20 people or 25 people actually show. And so we just want to make sure that our physical representation or physical attendance represents those who have actually registered for the event. So we know that life happens, things happen because we do try to set everything up at least 3 weeks in advance so that people have time to register and put it on the calendar. So what we began to do is posting small vignettes of individual social attendees who are sharing their experiences of the event. And we post that on the website. Our social media coordinator will also grab testimonials or quotes from individuals who have attended the socials or even from the presenters. And we will post those quotes and those testimonials on our social services, on our social media sites as well, so that people can get an idea and get a feel for who's coming and what they're receiving when they attend the socials. And so we're hoping that will increase the physical attendance. The other thing that I have begun to do is the attendees who are at the socials, I'm requesting their nurse navigators information or their physician's information so that I can partner with the nurse navigator or with the physician's nurse, and I can send them a flyer to say, hey, we have this social coming up, so could you help me promote this in your office? If there's someone else that you know that may need these services or could benefit, then please share this information with them. So the hope is that with partnering with these nurse navigators and other patient navigators, that we can begin to reach more people and let them know about our socials. Now on to the successes, yay. Okay, so what I'm very, very proud of is that when we began this program, our goal was to only service 66 African American women. We have surpassed our target number. And like I said, we are at approximately 127 navigated patients. It is probably a few more than 127. But we do have some that are still kind of in limbo. So I've navigated them to a certain point. So I have not necessarily documented them as a completely navigated individual. So we definitely have a little more than 127, but we definitely have 27 that we've documented, and we've come to a kind of closing point for them. We have new partnerships that have been developed with other area breast centers for mammograms and treatment, transportation services, prostheses. So we're really excited about that. We are currently working and in talks and negotiations with Park Plaza, Houston Northwest Medical Center, and even Nordstrom's prosthesis program. So we're really, really excited about that. And of course, if anyone knows anyone else, or if any of you out there would like to partner with this, we'd love to hear from you. We have new positions that have been added to our resource list. We've received several requests for presentations of the navigation program, as well as information about Sisters Network, Inc. We're very thankful to be here today with Breast Health Collaborative presenting to you all. We have presented to the Prairie View Retired Teacher Association, the Department of Breast Medical Oncology research staff at MD Anderson, as well as other organizations. And we have several donors who believe in the program, and they believe in the program so much that they have provided gifts for our social attendees. They've donated things like spa treatments for our attendees, t-shirts, concert tickets, massages. We had some individuals come out from Mary Kay who did makeovers for the ladies, and that was just such an amazing, it was just amazing to see once the women were made over, some of the women who were still going through treatment, when they had their faces made over, they just had a new walk about themselves. They stood up a little bit straighter and they felt so good. And so this again lets me know that people understand the program, they believe in the program, so they want to support the program. Evaluation and tracking. We do an awesome job of evaluating and tracking our progress when the evaluations are completed in-house. So what that means is at the end of the Survivor Social, we give evaluations to the attendees. As long as they're doing it on site, then we can get 100% participation. The challenge, or what we've run across, is we've also tried to do internet evaluations. However, internet evaluations provided a low response to us. So we have just decided that, you know, we would still try internet evaluations. However, we know that we will be successful with our evaluations if they're hands-on, if they're done at the end of each session. So that is how we evaluate, and we evaluate after each session to see how the attendees felt about the session, and what we could do better, and what they would like to see in future sessions, or future social, excuse me. And currently we are doing our final evaluations of the program as a whole. Every patient that has been navigated, we have sent them an evaluation for them to evaluate the program as a whole. How do you feel this Navigating Through Survivorship program helped you? Was it a help for you? Did you have an opportunity to talk to the patient navigator? Did the patient navigator give you what it is that you needed? Do you feel comfortable? Is this a program that you would refer to other people? So we're in the process right now of collecting those final evaluations. So I'm looking forward to the responses. Recruitment and service delivery. This is just a little bit of, these are our social flyers. And if you look at the first social flyer, it just says Breast Cancer Survivor Social. This is just a general flyer that we put it as a binder cover, if you will. Each one of the attendees gets a Survivor Social binder. And it's important for me as the patient navigator that they have this binder, because I want them to be able to utilize this as a resource. So any information that they receive from the Survivor Socials, whether it is printed pamphlets, whether it's a resource list, whether it's the PowerPoint from the presenters, they can put that information, which is separated by month. I make sure there are tabs in there. So it's separated by month. So after it's over, if they need to go back and review what it was that we discussed in the social, they have those resources and they have that information. So that binder is something that they can hold on to, hold on to. So that first slide is for that, and that's at the front of every survivor's or every attendee's Survivor Social binder. And the next one is these are just some of the flyers that we had for each social. And we really try to promote these socials and who the guest speakers are. So if you recall from one of Kelly's slides, you saw a picture of you saw a picture of the presenter, the presenter's name, and the organization and/or hospital in which they're affiliated. So we try to put that information so that we can give as much information about the upcoming social as possible on the flyers. We also have intake forms. And so these intake forms help me as the patient navigator determine what the needs are for each navigated patient. It just gives me it's a short one-page form that the attendee or that the client does not even have to fill out themselves. I fill it out for them as we're conversating on the telephone, or if they come to the office and we're talking, I'm filling out the information. I'm getting, their name, their address, if they prefer to be contacted via telephone or by email, if they want to share email address. What was their diagnosis? What type of treatment did they have? When were they diagnosed? What is their current age? So now can I potentially give them information about the YSI program because they are a young survivor? Or can I connect them with a survivor who may be a little more seasoned, if you will? So I'm able to gather that information on the intake forms. Also, another part of the intake form asks about insurance, if they currently have insurance, because there are several people that I navigate who have one concern, but then the other concern is that they don't have insurance. So how can I help them through that process? If they're in Houston, can I help them get a gold card? Can I direct them to the BCCS program, the Breast Cancer Assistance and Medicaid program? What can I do for them? So I'm able to gather that information on the intake form, and there's an intake form completed on every patient that I've navigated. And this information is definitely it's confidential once I gather the information. And my goal or hope is to have the patient navigated within 30 days. We do know that that does not always happen, just depending on the situation of the client. But the goal is to strive to have them navigated within 30 days. These are just some collaboration and partnerships that we currently have, and some that we are still working to bring together. So again, we have Houston Methodist, Cancer Treatment Centers for America, Breast Health Collaborative, Iman, The Rose, as well as some others. And then I wanted to just give you guys an idea of a few of our upcoming events, meetings, and trainings. We did have our March Survivor Social on March 15th, where Dr. Tika McKnight came and she spoke to us about cancer vocabulary. There's just so many terms that we hear when we're diagnosed with cancer, and what do these terms really mean? So she was an awesome presenter. March 27th and 28th, we do have the CDC Advisory Committee, the Young Women in Breast Cancer. We have our Stop the Silence Walk on April 5th, our webinar Wednesday, which will be on genetics this month on April 16th. And then, as Kelly mentioned, we have our National African American Breast Cancer Conference and 20th anniversary, October 9th through 12th. And we are always promoting our Teens for Pink and doing those presentations on various dates at various schools throughout the Houston area. These are just a few pics from our Survivor Socials. The top one, that was our nutrition and fitness. The ladies had a really, really good time with nutrition and fitness. They weren't scared of a little workout. And then we socialize afterwards. Lunch is provided, or a small snack is provided after the socials. And then we just kind of have fellowship time, if you will, at the end of the social, so you can get a feel of who you've been sitting next to, who you've been sitting in a room with, and you can make connections and possibly friendships because you're connecting with other survivors, some people who are going through what you've been through, or who've been through what you are now going through. So what are our next steps? Our next steps are to secure a national and or local sponsor for this program. because we found that there is a need for the program, and we found the program to be very, very effective and successful. And so we really want to launch it in our 41 affiliate chapters as well in other cities, so that those individuals can receive the same things that our survivors are receiving here in Houston. So thank you guys very much for spending time with us today and learning more about Sisters Network Inc. and our Navigating Through Survivorship program.
All right, that was awesome. Thank you. We're now going to open up the phones as well as online if you all have any questions. So let me unmute the phone.
All callers are muted. All callers are unmuted.
Everyone, please feel free to ask any questions that you may have. Any questions in the room as well. Someone typing. We have a question. So, how many patient navigators do you all have?
One.
And that's one nationally?
Yes.
Yes. Just one.
Again, this is a pilot program, so we're hoping we would love to be able to get a national sponsor and be able to have navigators in maybe regionally,
Okay.
just to be able to work that out. But we have one.
Awesome. And as for now, y'all are just in Houston
Yes,
navigating.
the presentation that she discussed today was for our Houston project, and that was oh my God, can't believe you mentioned that this was made possible through our Coleman grant. We received a grant from the Houston Susan G. Komen affiliate. So that project actually ends in a couple of days. I think it's March 31st. So again, we're now looking at shopping the program around to do it nationally.
Can we repeat that answer one more time? They're saying they couldn't hear it over the phone.
We have oh, she couldn't hear. The answer is
Yes.
one. We have one patient navigator, and this particular project was made possible through a grant funded by the Susan G. Komen, the Houston Susan G. Komen affiliate chapter, affiliate office.
She said thank you.
Okay.
Any more questions? I'll leave it open for a moment. How much is the registration for the walk if you want to register same day?
The walk day of registration on site is $30.
Oh, I guess I'll close it to questions if there are no more. I just want to thank you, say thank you to Kelly and LaTanya. Excellent presentation. Learned so much I did not know about your organization.
Thank you.
I'd also like to thank our program committee for organizing our webinars. The committee is chaired by Denise LaRue of Harris Health System, and the members include Linda Civalleto with MD Anderson Cancer Center, as well as Laura Pena and Lizette Martinez, both with Harris Health System. Our next free webinar is Thursday, April 24th on support for caregivers. It will be presented by Dr. Lori Williams with MD Anderson Cancer Center, and registration will be available later today, if not next week, on our website, and that's www.bhctx.org. And again, we just want to thank everyone for coming. We always appreciate it, and until next time.